Hello everyone! Thank you so much for attending and welcome to our webinar with Dr. Natacha and Paul from Fullscript. My name is Melissa. I'm part of the marketing team here at Fullscript, and we're super excited to have these two experts here with us today to go in depth on how to craft your most effective recommendations. We'll start off with a pre-recorded session from Dr. Natacha Montpellier, and then we're going to dive into a live treatment planning demo with Paul, and we'll finish off with a live Q&A. Before we get into all of that, I just wanted to go over a little bit of housekeeping. So this entire webinar will be recorded, and then we'll be able to send that recording to you if you're registered, well, everyone that's registered. So if you have to leave early or you want to watch it again, you'll have access directly in your email inbox. The recording will also be live on Fullscript's website. That's fullscript.com/webinars, and where you can access all of our past and upcoming webinars too. Throughout this webinar, if you have any questions, please add them to the Q&A section on the sidebar, and we will get to them during the live Q&A period at the end. Okay, so that should do it for all the housekeeping I had. Again, I want to take this time just to thank Dr. Natacha for her contribution to our webinar. Dr. Natacha Montpellier is a registered naturopathic doctor with the College of Naturopaths of Ontario. And at the moment, she maintains a private clinical practice focused on hormonal and reproductive health. She also serves as a medical education and research specialist on Fullscript's integrative medical advisory team, where she supports healthcare providers with evidence-based educational content. So I'm now going to press play on Dr. Montpellier's pre-recorded session, and I'll rejoin afterwards to get into our live demo and then our Q&A.
Hi everyone, I'm Dr. Natacha Montpellier. I'm a naturopathic doctor and I've been practicing close to 8 years in Ontario, Canada. I have a clinical focus in hormonal and reproductive health, and I'm also the medical education and research specialist at Fullscript. Now, I'm really excited to share with you all today the various tools that Fullscript offers to better support treatment planning and treatment delivery. So let's get started with some evidence-based treatment planning tools. So first up, we have Mytavin. So Mytavin is a nutrient depletion tool, and this can help you identify any nutrients that might be at risk of depletion due to medication use. So we're going to go on to the website and I'll show you how you can use the Mytavin database. So you go to mytavin.com, and here you can select from the popular searches when it comes to medications, if the medication your patient is taking is there. So in this situation, our patient is taking metformin, but they're also taking Crestor. So we're going to use the search function to find Crestor. Excellent. And then we'll just click on Find Deficiency. But again, you can add any medication that your patient is taking. They'll all pop up here underneath the search bar. So we'll click on Find Deficiencies, and the database has pulled up 4 deficiencies, so 2 for each medication. So metformin, it pulled up folic acid and vitamin B12 as possible risks of deficiency, and then for Crestor, it pulled up CoQ10 and selenium. Now, if you want to read more or learn more about these deficiencies, you can click on the Read More for each of those ingredients, but you can also click on the plus sign here, and I'll just show you the evidence that has been cited for each of those deficiencies. And if you want to read the evidence, you can just click on the little hyperlink button and it will bring you directly to the research paper that is linked there. Now, if you ever feel unsure about where to start when it comes to recommending supplements, Mytavin could be a great tool. Just put in your patient's medication list into the database, and then you can see which nutrients might be at risk of depletion, and then you can select a few products to help kind of mitigate or prevent those, or even correct some of those deficiencies your patients might be experiencing. Now, the second treatment planning tool we'll discuss is our Practitioner resources. So we have over 170 evidence-based resources, practitioner resources, which are all developed by our medical advisory team. On this specific slide, I've highlighted 3 of our guides. So we have a drug nutrient depletion, a pharmaceutical interaction guide, and also a health system innovation guide. I've also highlighted one of our white papers, this one on treatment adherence. Now you can access these documents directly from this slide by clicking the click here, but you can also access the greater 170 resources by visiting fullscript.com or even by visiting Fullscript Academy, and we'll discuss Fullscript Academy on the next slide. But for now, let me show you how you can access these resources on our website, fullscript.com. So we'll just go right here. And once you arrive to the Fullscript website, you can go to the Learn tab right here, and then just go to Practice Resources. And it's going to bring you to this page where you see all the different types of practitioner resources that you can use with your patients. So we have handouts and guides, and you can also click the infographics if you want. So these are patient resources that you can use with your patients. And then we also have practitioner promotional resources, practice management resources as well. Now let's go to Fullscript Academy. So Fullscript Academy is designed to help you upskill your clinical and practice management skills. So we've partnered with our top academic leaders in integrative medicine to provide you with over 20 courses, some of which are CE or CME eligible. So on this slide, I've highlighted some of the courses that Fullscript has put together, and that's based on the research we've conducted. So we have one on Supplements 101, Quality 101, so supplement or quality rather in the space of supplement quality. And then we also have one on behavioral change. Now, as you can see on the slide, all of these courses are free, and these specific courses are also CE accredited. So let me show you how you can access Fullscript Academy. So you want to go to academy.fullscript.com. And to look specifically at the courses, you can go to practitioner courses just at the top. You can see those that are categorized as all the courses. Those are just CE courses, CME courses, and those that have no accreditation at all. So we're just going to go to the CE courses. And here you can see the courses that are CE accredited. You can see the Fullscript courses that are there as well. We're just going to go into the behavioral change course so you can see what that looks like. So once you're ready to start the course, you can click on the green button here, and that will help you register for the course. But if you want to learn more before registering, you can look at the details, the course instructor, and then look at the topics that are covered in each of the chapters that are available here. Now, as I mentioned, you can also access some of the practitioner resources via Fullscript Academy. And so you just need to go to the resource library in Fullscript Academy to see those practitioner resources. So we have white papers, practitioner guides, and also practitioner handouts. We're just going to go to the white paper section. And here you can see the guides, the one on drug-nutrient interaction, treatment adherence, and also supplement quality. Okay, let's move on to our protocols. Now, protocols are probably one of our most popular tools. We have over 40 evidence-based protocols. Now, each protocol contains a variety of ingredients with the supported evidence, such as the magnitude of effect, the dosing strategy, and also any safety information that's relevant. And all of that information is referenced, so you can go back to the original information. Now, the protocols also contain pre-selected products, and the reason for this is that you can apply the protocol directly to your treatment plan. You can also modify any aspect of the Fullscript protocols, as well as create your very own. And we're going to go into the Fullscript app, and I will show you how you can work with the protocols. The biggest benefit of using protocols, I find personally, is that it reduces the time you spend looking for ingredients to treat specific or to address specific conditions, but it also reduces the time spent looking for the corresponding product. And I find that can be especially frustrating when you know that you see all this evidence for a specific ingredient and you can't find the corresponding product. So that really helps to cut down on that time and help with your workflow. So let's go to Fullscript, the Fullscript app, and I'll show you two ways you can access these protocols. So first we'll start with this prescription button here. So we'll go to protocols. Now, if you've never used protocols in your Fullscript app, this section, my protocols, would be empty. So just imagine that there's nothing that's here. We're going to go to the Fullscript protocols, and you can filter the protocols according to the different categories that we have here. But I'm just going to look for something about blood sugar. So I see that there's a blood sugar support protocol. So I can just view kind of the bones of the protocol, which is just the products that are recommended and also the attachments. So this is what would be transferred to your treatment plan to your patient. But if you want to see the research behind these selections for these ingredients, you can either view details here, or you can click on view details here. And here you'll see kind of a brief overview of the condition that's being addressed, and then also all of the ingredients and the supportive evidence, as well as the dosing strategy. And again, everything is referenced, and all the references are at the bottom if you want to learn more. And as I mentioned, each of the ingredients are associated with a product, just to help facilitate that workflow. However, you can change those products, and I'll show you how in just a moment. So you can use these to kind of skim through and find the ingredients you want to learn more about. And you can also look at all of the Fullscript created patient educational resources that we've attached to these protocols. So let's say that you like this protocol, however you want to modify it slightly, or you just want to have it more easily accessible. So what you would do is you would copy this over to My Protocols. So this does, and I'll show you in just a moment, we'll open this up. So within this view, you can modify this protocol however you want. So you can change the products, remove ingredients completely, and even change the dosing methodology if you want your patients to be taking that for longer, shorter, or even change the amount of capsules. And then you can also add or remove any of the handouts here. You can even upload your very own handouts. So once you've made all those modifications, you'll see kind of how much the protocol costs just down here. And if you've applied a savings to specific patients or to your entire dispensary, that will be, you'll see like maybe 10%, and then you'll see how much that costs. And then you just update your protocol. Now, this new modified protocol is you'll find it in your My Protocols. So again, if you use a few key protocols or you're creating protocols and you want to be able to easily find them, then you can just kind of copy them over to My Protocols. As I mentioned, you can create your very own protocols from scratch. So you can just go here, and then you can add your message, you can add any resource, either Fullscript resources or your own resources, and then you can add your supplement protocol. So any of the ingredients you want to include. So as I mentioned earlier, you can share these protocols with multiple patients simultaneously. And so to do that, all you need to do is hover over the protocol that you want to share, click the share button. You can select specific patients. If you're running a specific program, you just want to share with them, you can select them here, or you can make it public. And by doing so, you just share with all patients, you get a URL here that you can share in your newsletter or however you want to share that specific protocol. Now I'll also show you how you can access the protocols from within the treatment plan tool. So we'll go to the new prescription button here. And here we'll go to the apply protocol. And again, you can look through just your protocols, you can look through the Fullscript protocols, and you can also share protocols with colleagues. So you can also, if you're looking for a protocol a colleague has shared with you, you can also look through that tab. We're just going to look through the Fullscript protocol, and we're going to look for that blood sugar. So you can view the protocol, which again, it's just going to show you the ingredients, the products, and any handouts that are attached to that. But you can also apply, where everything will be applied to your treatment plan. I also want to mention, if you look at that view section, you can, if you just want to add the berberine, you can just add that and not necessarily apply the entire protocol, but you can also apply from here. And that's what we'll do. We'll apply the entire protocol. And here we see, again, you can modify any aspects of this protocol once you're within the treatment plan tool. So it's not like you can't modify anything. You can remove the handouts, add handouts, and also change any of the dosing. Now, once you've selected your supplements, you can either use the dosing strategy that the supplier has provided, which you can see here. All the products come with preloaded dosing strategy, but you can also customize it. So you can increase the capsules, the frequency, and even the duration. You can also write messages in this text box. You can, see here, you can use a supplier dosage, text only, or you can even save a default dosage. Now, this is a very important step, as this will allow you and your patients to benefit from some of the tools we'll discuss in a few slides. Actually, I think on the next slide, we'll talk about some treatment adherence tools. So it's really important to fill out that information, yes, for your patient to know how they should be taking that supplement, but also for adherence long-term. Now, I also want to show you the catalog function. So our catalog function is also a great tool that can help you prescribe or even discover supplements with ease. So sometimes I might have an ingredient in mind, but I don't know which brands offer that particular ingredient. And so what I'll do is that I'll just write the ingredient and then see what I can find. But you can also add in this search bar, you can search by product name. If you're looking for your specific product, you can search by brand name, and you can even search by health condition. But in this situation, we're going to look for inositol. inositol. Like I mentioned, you can search by product name as well, but we're going to click on inositol. So this will allow me to show you some of the filters that you can use when you're looking for ingredients. So just on the right-hand side here, we have filters right next to the search bar for easy to find. So you can search by brand, which brands, if you want to look specifically for a few brands that you trust, if they offer inositol, you can select that. You can also include ingredients if you want your inositol to also have chromium or folic acid. You can look for ensure that you're excluding ingredients. You can also filter by form. So if you want a powder, a liquid, a chewable, a tablet, all those kinds of things. You can also make sure that you're excluding for allergens if your patients have any allergies or intolerances. And then we also have our quality certifications, which is can be a great tool to use to find, the perfect product for your patient. So if you want to make sure that it is vegan or GMO, non-GMO or organic certified, you can use any of those filters to kind of find those products that fit those specific characteristics. And one last thing that I want to just point out is that with any of these products, just remove the filters, you can also favorite them. So you can add them to your favorites, and you can actually create categories. So your favorite blood sugar regulating products. So if I go, I want to use inositol, add to favorite, and let's say you've created one for acne or you have one for blood sugar, you can create your own little your own catalog essentially of your favorite products. So that's also another great feature that you can use, again, to just kind of accelerate that search so that you're wasting less time looking for your go-to products. Okay, let's move on to treatment delivery. So all those tools are to help with treatment planning. Now we're going to move on to treatment delivery. And we're going to start with some treatment adherence tools. So as I mentioned earlier, I'm just going to backtrack just a little bit, go back to our treatment plan. I had mentioned that this is a very important step for our treatment adherence tools, and these are the tools that are dependent on this. So we have the refill reminders, which are notifications that patients receive to refill their prescription, and this is based on the calculated dosing or duration you specified in the patient's treatment plan. So if they are to approximately run out in 2 weeks, then they will receive an automatic reminder encouraging them to go back within the Fullscript app and place another order so that they don't experience any gap in their treatment. Now, auto ship is really more of a personalized refilling experience, and this eliminates the patient's need to return into the app to place their order. So products are automatically shipped to the patient on a schedule that they've customized. So AutoShip is completely customizable, meaning that your patients can set individualized schedules for each of their supplements. So if they have one supplement that runs out in a month, they can have that come back order on a recurring basis on a monthly basis. If they have a product that ends in 2 months, then that product can be shipped every 2 months. So that this eliminates the fact of having, an oversupply of one particular product and lacking in another product. So it's a really great feature to help patients stay adherent, help them keep on their treatment plan and experience the health benefits that they're looking for. Now, the second treatment adherence tool is the Insights Dashboard. So the Insights Dashboard can give you statistics on adherence statistics, such as the percentage of your patients that are signing up to your online dispensary, the filling rate, and also the refill rates. And I'll show you how you can access the Adherence Dashboard in the Fullscript app in just a moment. But before I do that, I do want to share that within the dashboard, we also have the adherence survey. And this is the right questionnaire you see on the right-hand side. So this is a one multiple choice question survey that's automatically sent to patients who have not fulfilled their treatment plan within 7 days. And so essentially the question or the survey asks why the patient hasn't fulfilled their treatment plan yet. And they have a multiple choice. They can select from any of these options. And these options are based on the research that we conducted on treatment adherence, and they are common barriers to treatment adherence. So they're not necessarily just random, but based in research. So a patient may indicate that maybe there's a concern in regards to the cost. Perhaps they're feeling overwhelmed about the treatment plan. Maybe they're purchasing their supplements elsewhere, so they are adherent, it's just not necessarily showing up in Fullscript. Maybe they're planning to purchase their supplements, they just haven't done so. And perhaps they're not planning on ordering at all. And so that might spark further investigation. So the qualitative and quantitative data provided by the dashboard can really help you build a better patient engagement strategy if that's what it's indicating. So let's just go into the Fullscript app and I'll show you how you can access this Insights dashboard. So again, you just go to the prescription button and you go to Insights. And here, like I mentioned, you'll see your adherence statistics. So how many patients are unactivated, how many have not ordered, and how many have missed a reorder. So they haven't refilled their order. And to find the adherence surveys, so you'll see when the adherence surveys are to be sent. This is based on if they haven't fulfilled their treatment plan in 7 days. And I'll just show you an example of what it looks like when someone has filled out the treatment adherence or the adherence survey. So I'll just find one of our demo patients here. So when a patient has filled that questionnaire, you'll see that a show feedback button will appear next to their name. So you just click on that and you'll see within this kind of little gray square the reason that they've selected. So prescription was out of my budget. So this can kind of just spark some further investigation into products that are more budget friendly so that your patient, again, can be adherent and then also experience the benefits that they're looking for, achieve their health goals. Okay, let's go on to the next tool. So again, continue within the theme of treatment adherence, we also have a large selection of evidence-based practitioner resources to better support treatment adherence and behavioral change. So these are resources that you can use for yourself to enhance your knowledge, but some of these resources you can use with your patients. So we have a questionnaire that you can use with your patients to assess their readiness or their level of readiness to change. And that can, depending on where they are in that kind of theorem, it would maybe change how you might approach their treatment plan. We also have a goal setting worksheet. We have a concise handout on how to better support your patient's behavioral change. So it's a little bit more of a condensed version of the white paper that we have. We also have a handout on treatment adherence, and we have a healthy habit tracker that you can use. These is just a sample of those tools. Again, you can access them directly from the slide, but if you want to see our big library of practitioner resources for treatment adherence and behavioral change, you can access them through the resource library in the Fullscript app. And I'll show you that in just a few slides in the app, how you can access the resource library. Because I want to show you also that within the resource library, you can also find patient educational resources. So we know that as practitioners, educating our patients is vital to treatment plan adherence or treatment adherence, as well as their health outcomes. But curating and even creating evidence-based, health literacy-friendly resources can be very time-consuming and very overwhelming. So to solve this issue, Fullscript has created over 160 evidence-based, beautifully designed patient resources. So within the library, you can find infographics, handouts, longer guides, tracking sheets, recipe books, and even meal plans. And you can attach these resources directly to your treatment plan, or you can download them and provide them to your patients, either through if you email them, or if you print them, or if you upload them to your own electronic health record. However, if you are using an electronic health record, there are many, or Fullscript is integrated with many of those health records. So it's worth looking into to see if your electronic health record has an integration with Fullscript to really help enhance that kind of workflow and eliminate unnecessary steps and kind of a waste of time. So here is just a sample of patient educational resources. Again, you can access them directly from this slide. Here it's all kind of themed digestive health. However, we have on many different topics. But again, you can access them through the resource library, and I'm going to show you how you can do that right now. So we're going to go back to Fullscript, the Fullscript app, and you can access the resource library right from the prescriptions again, and you go to resource library. And here you can see all of the Fullscript content. And so you can look by category, so nutrition, lifestyle, physical activity, supplements, and also by health condition. And then also by type, if you're looking for a guide, handout, infographic, meal plans, recipes, and also worksheets. You can view the handouts just by simply clicking view, and you can also add them to your library. So it's more kind of an easier access, a quicker access in finding these resources that are kind of your go-to and using very frequently. You can also, access, let me go back to our treatment plan, and you can also add them attach a patient resources. So that's a different way of accessing the resource library through the treatment plan tool. So again, you can sort by type and also by category. And then you can kind of just view, oh yes, that's the one I want to include. And then you can attach it. You can also upload any attachments as well. Okay. And that's everything that I have for you today. Thank you very much for your attention, and I look forward to answering any of your questions.
So many great tips and tricks and nuggets of information in there. Thank you again, Dr. Natacha. Up next, we have Paul Cianciulli, who will walk us through how to best utilize the treatment plan writing tool. Paul is a customer growth specialist here at Fullscript and has been working in the industry since 2006. Specifically, he worked for Nordic Naturals as well as Pure Encapsulations for 7 years, respectively, as a sales rep. A true expert in the Fullscript platform, I'll pass it over to him now to talk treatment planning.
Thank you so much. Yes, the RX tool, it's probably the best tool that we have at Fullscript. It's going to drive maximum adherence from patients and also have the best ability to generate revenue for the practice. And I think one of the main reasons why is that it makes the process super simple. Dr. Natacha really laid it out quite beautifully just on how easy it is to use, but it makes it easy for practitioners to recommend, and it makes it really easy for patients to order the right products, no mistakes, and it gets sent right to them. And it's just a really great tool that we have here. One of the things to keep in mind with the RX tool that I think is really important is that clients are 2 times more likely to purchase if they're sent a Fullscript recommendation or RX, depending on the terminology that you've got in there for it. And then what I was going to do was I really wanted to show you again just how simple and easy it is to use. So I'll go ahead and demonstrate that now. First, I'll show the RX tool from the practitioner's perspective. I can show how it's created there. And then what I was also going to do was show what it looks like on the patient side when they get those prescriptions sent to them and how they can order. So I'll go ahead and share my screen here for you. So this probably looks familiar again from the presentation, but this would be the homepage of your dispensary when you log in. And the feedback that I get most often is that this new prescription button is probably the best way for practitioners to use the tool, because you can just jump right into it and select a new prescription. And this is a great way to start it because you have the ability to select your existing patients right here. You can just simply search by name. And if they're a first-time visitor with you, you can also create the account right here as well. And so you would just have this pop-up come in and you would enter their first name, last name, email. I would encourage a telephone number here as well, because they'll also get the text notification that the prescription is sent to them, and they can easily access that from a smartphone. Down here is where you would put the message, and we also have these convenient snippets that you can use. And what these are basically saved messages that you can just pop in, and that can save you some additional time. These are the 2 kind of default ones here. You can also create your own snippet by just simply typing. And once you start typing, you have the option to create, and then that will be saved here as well. And to manage that, you would just go into Manage Snippets, and you can see all the different ones that are available. And to make them active, you would just click the star, and then they would all pop up there from this preloaded message. From here, you saw already too, the patient resources. You would just go in and you have the ability to select all the different types of resources that we have. The guides, the handouts, the infographics, and the meal plan. You even have the ability to upload your own attachment, which is also quite useful when sending RXs. From there, you would simply add supplements. And this was also demonstrated quite well, but you have the catalog here and it will default to your most frequently prescribed products. You also have the ability to search amongst your favorites, so you can narrow it down to save yourself more time. And then you could even go off a patient history as well. So if we had a patient pulled up here, you could look through their history in order to see what they've ordered in the past. But if we're going from the catalog, let's say we're looking for magnesium. And then we have the filters again. You can narrow it down by favorites, narrow it by brand, include ingredients, exclude ingredients, form. There's quite a few different filters you can apply to find the right product for your patient. I'll just go ahead and select this one for now. And I'll select myself as a patient. And Dr. Natacha pointed this out as well, but you have the ability to change the dosing instructions, the duration, and this additional notes button is really helpful. You could always add special instructions to eliminate confusion. For example, you might say, take with food. And then from there, you would just send it off. And so when a patient logs into their dispensary, they're first brought to their plan page where they can see all of the prescriptions that have been sent to them by their practitioner. And so they have the ability to add to the cart this way. So they'll be able to view all these. They see the instructions. They can see everything that's listed for their dosing instructions, and they can either add individually or they can add all to the cart. And then the other option too is we talked about protocols, and when you share protocols with patients, that's a separate tab that they have access to. And this is what those ready-made protocols look like for them on their patient account. So it's a separate page from their plan page, but then they have the ability to take a look at these and decide if that's something that they want to purchase as well. Right, excellent. Okay, and that is the RX tool and the patient experience.
Thank you so much, Paul. That was really a great demo. Really appreciate all of your insight put into that. We're now going to open up our live Q&A. So I'll read out any questions that came in during the presentation. And anyone in attendance, you can also send them in now by typing them out in the Q&A section to the right-hand side of the webinar. Just going to pull them up. Bear with me one moment. Okay, so the first question we have is in relation to protocols. If I share a protocol with my patients, will they be notified? So I'm not sure, maybe Paul or Dr. Natacha.
I could certainly go ahead and answer this one. So it all depends on how you're sharing your protocol. So if you're using the share protocol, like I mentioned, like shared like with multiple patients simultaneously, in that situation, your patients won't receive any notification. Just as Paul showed in the patient view, when they log into their app, they'll see the button that says shared protocols, and they'll see whatever protocols that you have kind of made public to your patient population. If you are sharing a protocol through the treatment plan tool, then yes, they'll definitely receive a notification that they received a new kind of treatment plan and maybe based on the protocols. But yeah, that's kind of what I would say with those. I'm not sure if I missed anything. Paul, if you have anything to add to that.
That's pretty right on. The only other thing I might add, Dr. Natacha, is when sharing a protocol, you have the option to select patients and click on their individual names, and then you can send them an email notification that way. Right. But it's, that would be the only other thing, but I don't think it gets used very frequently that way. You're better off doing it like you mentioned, though, is just applying the protocol directly in an RX and sending it that way.
I suppose that would be kind of more of a popular option if you're running some sort of program and you have like a list of people and you just want that particular protocol to be shared with, let's say you have 10 people in that protocol, and then yeah, they'll receive notification for your protocol.
Bingo.
Okay, right on. Thanks, both of you. Another question here. Paul, you touched on treatment plans. Maybe you want to dive into this one first, not sure. What if I don't want to receive a profit from treatment plans that I send to my patients?
Yeah, that's certainly an option. There's a couple of ways to do that. You know, when you first set up the account, you can, I believe, are they still defaulted to nonprofit? I think is the default when you set up your account. So that would, you know, you wouldn't be paid anything for any prescriptions that you're sent or any purchases that are made off the dispensary. The other option is that you could just give away the full discount to patients by selecting that in the dispensary payouts. So if you set the full discount to 35% off, you would not be receiving any profit from any of the sales that go from your dispensary.
Okay, so in that case, you would become a profit dispensary, but you're still not receiving profit technically.
Correct.
Okay, it's a great little workaround for sure. Okay, another one here. Searching the catalog using form and ingredients filters was covered. Can you provide more information on how to search related to specific health conditions in terms of catalog search?
I can take that one. There's a few different ways you can go about it. So in using just the search bar in the catalog, you could put in conditions in there, and that would pull up all the different products that are tagged within that particular condition. Also within the filter section, there was also a health condition filter. So again, you can, it could be adrenal, it could be thyroid, and again, similarly to the to adding the condition to the search bar, it's going to bring up all the different products that are associated with that condition. And then the last thing is just going back to the protocols. So all those protocols come with preloaded products. So that would be one way to search by condition, because the protocols are all by condition, and then you would find kind of the appropriate ingredients and also products associated with those different conditions.
Okay, that's perfect.
Yeah.
Thank you. A last question here. I guess we kind of covered, how the treatment plan looks to a patient. Is there any difference in that experience when it comes to protocols in terms of how it looks for a patient?
Well, I thought I tried to demonstrate that. So that second demonstration that I did was the patient side of it. So when they get to their homepage, there's those two tabs, and the first tab is their plan, and that shows up front and center. And then there's that second tab where you can tab over and view the protocols, and then they're all kind of listed out there. So depending on how many protocols that you have shared with the patient.
Okay, perfect. Thank you, Paul.
Yeah, I could show it again too if you guys would like.
Yeah, might as well. It can't hurt.
Okay. Yeah. This would be a patient's dispensary. So when they log in, they have their treatment plan presented to them. And past treatment plans too would be listed all below. And then the second tab where it says shared protocols, these are all the protocols that the practitioner has shared with them or made public. And so when they tab over there, they'll see ready-made protocols. And this is how they look. They really see the name first and the total, and then what they would have to do is click on each individual one to see the products inside of it. And so basically when they click in, they'd be able to see all the products. This one only had one product, but this one has 9 products, so they can click on it. And then they would have access to any notes that are in there. They can see the attachments that are attached to it, and then they can scroll down to the different products that are included.
Perfect.
So, yeah.
That's great. Yeah, thank you so much for doing that.
Of course. Yeah, no
problem. All right, so that concludes the Q&A portion of our webinar here today. I want to thank both of our speakers, both Paul and Dr. Natacha, for your expert tips and tricks on all things recommending and protocols. And thank you everyone for attending today and for the questions as well. Just as a final reminder, a recording of this entire webinar will be sent to your inbox in the next few days, so keep an eye on that if you missed any parts or want to have a look back. that concludes everything. Wish you a great rest of your day.
Thank you, everyone.
Thank you.